Isabella, thank you so much for agreeing to the podcast. And we're going to dive straight in with our first question. Why does integrative medicine matter to you?
Oh, well, where do I start? First of all, thank you very much for the invitation. It's a pleasure to be here and also an honour. And it's so aligned with where I come from personally and professionally that, it's lovely to be able to have this opportunity actually of saying this is why. This is why I think it's so important that we do have this integrative approach. So for me, Elizabeth, it really is about looking at and truly seeing the person in their context, not just their symptoms or their illness, but everything about, who they are and where they come from. It's about understanding their values and their lifestyles and integrating that with what's important to them. I know that can be a bit cliched now these days, what's important to me, what really matters to me. But I think that is the very basis on which we actually reach out to people and be part of their story and their journey and be part of that support network. So, integrative medicine for me is very much a systems approach. Towards a more comprehensive and collaborative way of caring that addresses not only the disease or the conditions or the symptoms, but the overall health and well-being, the integrated person within that diagnosis or within that illness. And I think that's where we often lose sight of where we are as both as clinicians, but also as healthcare professionals, is that we forget about the person in the condition, the human in the condition, and makes them in particular human. So from that kind of philosophical perspective, but also, what it means to me is lived experience in that, I have personally benefited from a variety of evidence-informed modalities like traditional Chinese medicine, acupuncture, nutritional therapy, homeopathy, clinical aromatherapy, and even Ayurveda, for which I have a huge respect. And as a patient, if you will, or a client, and also as a registered health coach, where I've worked with a variety of clients that have also benefited from integrative approaches, I see how powerful it can be and how much we need this holistic wraparound, to support a person's health and well-being. And this is what I think the National College, and CIM play a hugely important part in this, in bringing together practitioners from lots of different backgrounds and lots of approaches to set those high standards, create and maintain an evidence base and push for more, research and education.
Yes,
I'm
yeah.
wholly aligned with it.
Thanks, Isabel. And I think you point out really well this diversity, both the diversity we might need in terms of modalities or approaches to get well again, but also the diversity within the multi-professional groups where there's mutual respect, understanding, realizing that different people have different knowledge. I'm aware that our listeners and viewers might not know what health coaching is, and some of the listeners might have a health coach in their general practice or a social prescribing link worker. So let's focus in on health coaching. If you tell us, what is it?
What is it? Well, it's a conversation like no other, if you will. The health coaches are not experts in any kind of clinical discipline. Some may have an additional or several additional scopes of practice, which, as therapists or doctors or nurses or nutritional therapists. But the single scope, the whole point of a health coaching conversation is to actually find out what it is that makes that patient or client tick, what is important to them, understanding how they can be helped to become a self-empowered individual in their own care. So it's shifting both the individual and the system from that reactive do to somebody to a proactive do with somebody. So it's helping those individuals find health literacy, understand their bodies, understand what's important to them, understand why they want their health. Somebody once said to me, the key to health coaching is asking the question, what is it that you want your health for? And that
Mhm.
is a hugely powerful question to uncover people's values, motivations, meaning, and help them build those steps towards self-empowered lifestyle and behavioral change. And health coaching isn't about telling people what to do; it's about helping them find solutions that matter to them. And that
Yes.
might involve giving information. It doesn't. We don't make recommendations. We don't give instructions. We don't tell people what to do. There's no diagnosis. There is just listening and supporting people with information, tools, techniques, and helping them explore what it is that they can do. What's the next thing that you can do to support yourself in this situation?
So
Yeah.
so crucial, and this empowered model is absolutely at the core of the integrative medicine model. And I was interested looking at the new NHS 10-year plan, really saying, prevention is really important. But unless people have understood this shift from heroic intervening model into empowered model, then it's very hard to support people into the next step. And I love the way you've described, what do you want health for? In other words, we all need a vision to get somewhere, don't we?
Yeah.
We don't get on a bus that says nowhere. We get on a bus that gives a destination. So I love this idea of the conversation, the space. It sounds like if you're, as a health coach, not recommending or intervening, it might be that it's good to work alongside others who might provide the approaches. Is that true or not? Or
Absolutely, yeah. Well, we have a number of different models now. Health coaches that work within the health space, those perhaps that are working within general practices or within the NHS or within private practices with doctors, with nurses, with other clinicians, work alongside them in a collaborative team. So we have the expert providing with an expert hat on saying, look, this is, let me put it this way, a three-legged stool. Okay.
yeah.
Imagine the seat of the stool is where we want our patient or our client to sit in transformed health or on the way to transformed health, empowered, self
Mm.
empowered to be making some decisions for themselves along the way. On the one hand, on the one side of the three-legged stool, we have the healthcare professional, the expert, the one that makes a diagnosis, recommendations, suggestions, devises a protocol, and does all the other things that we know expert healthcare professionals will do. Patient in the middle being advised, diagnosed, and supported by those recommendations, diagnosis, and sometimes instructions. You must go and do this. On the other hand, we have the health coach who is there to help them with the how. It's not the what. It's, oh my goodness, I've just come away from my GP or I've just, come away from my primary healthcare provider. And it's now being very much recommended that I do these 10 things. Where do I start? I've seen a nutritional therapist and he or she is saying, you need to do this. You need to change your diet, have these supplements, blah, 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 all of this. And where do I start? Now, people can get frozen in, they don't know where to start. It's too overwhelming. So that's when we start to break it down. And sometimes, unless there is a pressing clinical need for a particular recommendation to be first in line. It's sometimes better for the patient or the client to start with what would make the biggest difference for them to change now.
Mm,
Because
yeah.
when they start to see that result, they get the confidence to say, hey, I made this small change. I believe I can do it for myself. I can be this proactive agent in my own healthcare. And now I'm ready to tackle some of the bigger issues that my healthcare professionals have recommended. I tackle.
It it's crucial, isn't it? Because health creation just doesn't happen overnight. It takes a long time, and there's research to show that people are very overwhelmed with the conversations that they have with their doctors or practice nurses, and often go away quite confused. I mean, as you know, I've worked for many years in the cancer field, and people can get fully overwhelmed. But it's one of the things I encourage our team as clinicians to, although not health coaches, but many of them are doctors, to not recommend more than three things, and to work out those three things are the things that the person wants to do. Because one of the common things we can have is someone saying, um, I can't do all of those things, so I'm not doing any of them.
Yeah.
So, how do you break it down? Like, what would that look like when you're trying to break things down for someone?
Well, it depends really on where they are. So, you've heard this phrase, "We meet the patient where they're at," or
Yeah.
where they're at, and that's really important because and there's a whole continuum of where that person is at in their readiness to change.
Mm,
It really very much depends on, has that individual sought health coaching? Have they found out that, oh, there's a modality that can help me make these changes? So they very often come with, they are quite ready to change because they've sought it out. They've referred, if you will, themselves. um, Other times they are sent by a clinician, maybe it's the GP, maybe it's because of type 2 diabetes and blood's out of control, maybe it's any other reason really. And they will come in and they don't really understand what health coaching is, but they've been sent. It may take that coach some sessions to get a patient or a client ready to start thinking about the changes that they want to make. So we start usually by trying to tap into what's important to them. What are their values? Getting to know them as a person, allowing them the space to express what it is about their health that is of such concern, or their frustrations in, you know, not being able to make any progress with maybe not having a clinician answer the questions that they really want to ask because they don't know how to ask the questions. So there could be, a few sessions of getting that individual to the point where they can really see what it is that they want to do next. And then, depending on what it is that they want to do next, we look at how that goal can be broken down. And I want to really stress that there's a lot of talk in health coaching about goal setting and
mm,
smart goals and all of this. And of course, that's really as it should be. But that's often not the starting point. The starting point is helping the patient or the client seek clarity in what it is they want their health for, what it is that they want out of this relationship, helping them see that this is an opportunity for them not only to express feelings, emotions, frustrations, challenges, but also crystallize those key things that they feel can motivate them going forward, moving them from this kind of extrinsic motivation that, oh, if I reach that goal, if I lose this much weight, if I, do my 10,000 steps a day, I can tick that and go on to the next thing, to the intrinsic, what is it that I value? You know,
yeah. So you're really driving connection And again, this idea has come up with a few podcasts that with the right space and the right support, people can connect to themselves more deeply. And that mind, body, spirit, it's almost like our will force has to be behind what we're doing.
Yeah.
And when it is, there's kind of joyful flow when we're kind of feet away from what we're actually trying to do. And I mean, kind of in parallel, that can lead to disappointment because there's a constant feeling that one isn't achieving. But as you say, it can be achieving someone else's goals and not your.
Yeah, and
Mm,
that and sometimes someone else's goals actually are really important for your health, depending on your
mm,
health condition. That's sometimes what they must be encouraged and see for themselves, that I really must get to grips with this issue. But sometimes there needs to be a bit of work to be done before they can get to the place where they tackle that overt goal. And then, of course, it's not just about identifying the goal, but, it might be a huge one. How do we
mm,
break it down? What small steps can we take that build upon one another? How do we create accountability? How do we know when we're getting towards that goal? What about the challenges? What about um, self-sabotage, that I really, really want to do this, but get, I can't get out of my own way. Other excuses, we hear all of these in coaching conversations that have to be really sensitively handled and explored, and that takes time, space,
mm.
really acute listening skills, the
Yes.
ability to um, read between the lines and hear what's not being said as well as what is being said. And then being able, very importantly, when clients or patients get stuck, to be a little bit challenging and provocative, to make
Mm.
kind of, oh, I never thought about that, um, without being challenging to the point where, you're pushing them back.
You and you need that continuity, don't you, in order to because I know this myself, there'll be a place in our relationship where I will push a little bit more, where I'll, just try and get deeper into that emotional distress that is creating the barrier and try and explore an underlying need that isn't being met. And therefore, one might use food, or one might use TV, or the lack of exercise, or there's a myriad ways that, as you say, we can kind of undermine ourselves. And then that gets to the painful bit, the sore bit, that where we know we should do something, but it hurts to go in that direction of losing our protection.
Yeah. And people don't like change, sometimes
Mm,
it's easier and less stressful to, cling on to the habits and behaviors that don't serve us. And
mm,
know they're not serving us, but it's making that shift and making that consistently and with support and with not just self account. What we seek to do within health coaching is to cultivate self accountability for the longer term, but in the short term, having someone who is at your side, walking your path with you as an ally. You have got this sense of accountability to your health coach, that when you come to the next session, you'll want to be able to say, well, I have done this and I have achieved this. Or if not, you'll want to be able to say, do you know, I wanted to do that. I got stuck at this point. At which point then we say, well, what can you do next time that will be different? What other support
mm,
do you need? What can you put in place so that you can see that challenge coming? Um,
mm.
actually not confront it, but do carry on with the work that that you want to do and need to do without feeling that you've failed, and
Yes.
celebrating, the victories, the wins, the even celebrating the fact that you've determined that you're going to do this for the next 3 weeks and you've done it. And it might be just the smallest thing, but everything, the small goals, small steps, huge wins
I
often.
I like the way you mentioned systems approach within this model of integrative medicine. And I'm interested in this transformation of healthcare and believe that health coaching could be a big part of it. I was interested in the Integrative and Personalized Medicine conference that a GP team, GP and nutritionist team, were doing amazing work reversing type 2 diabetes, but they were struggling to get colleagues on board. And I do wonder whether the overwhelm that a lot of GPs feel, if they knew someone was going to work alongside them, i.e., the health coach would work alongside the GP
Yeah.
who would be checking in. Because I do think in this model, we want everyone interested in that health outcome. We want everyone interested in reversing type 2 diabetes or other conditions that we know now are reversible. But I just wondered, I want to tell our listeners and viewers that, of course, you're big into systems change because you've set up a whole network of health coaches. So I want you to tell us about that, but I also want you to talk to us about how you feel health coaching might support the transformation of the health system in the UK.
Oh my goodness. Well, I often say that, and I think truly believe that health coaching um, can be the beating heart of the future of medicine, of the future of healthcare, of the future of integration within systems. Because
Mm,
health coach, absolutely, because they're not clinicians, they're there for lifestyle and behavior change, help. They're there to support transformation. And as much as we've talked about the three-legged stool and the patient sitting on that seat, when working, supporting themselves towards that transformation. Health coaching is transformational at three levels for me. It transforms the patient or the client's outcomes. It transforms the experience of the clinician because
mm,
they are then left to do the job and the work that they came in to do. They're there for their expertise. They're there for, they regain that sense of achievement, that sense of job satisfaction, that sense of being the helper, being that transformational agent in one's health without the pressure uh, of all the other jobs that they feel that they need to do and actually have to do now.
mm,
So it really I haven't met, we have a lot of clinicians now, whether they are doctors at the highest level, oncologists, anesthesiologists, surgeons, my goodness, rheumatologists, nurses, doctors, physiotherapists, integrative practitioners of all kinds, all clinical professionals who have joined the association and have undergone either a portfolio route to membership and registration or they've done a full course. I haven't met one that has said, I wish I didn't know about health coaching.
mm,
They're not necessarily health coaches, but they know how to open a health coaching conversation in their practice, which is something very different from what they've learned in their traditional, conventional training. So at that level, we've got a patient with a transformational health outcomes. We've got practitioners, clinical practitioners that are transforming the way that they're delivering their healthcare. And we've got it at systems level in that by introducing a workforce of skilled professional health coaches to support people and clinicians, we've got a different way of delivering healthcare from the conventional way that we've always seen it. And with, for instance, the 10-year plan, all the stuff about neighbourhood teams, collaborative care, all of this is fundamental. A health coach can underpin not only every role within healthcare itself, but within society, Elizabeth. We need health coaches in the physical activity sector to
mm,
help PTs support their clients with, movement as medicine, if you will. We need them in the education sector. We need them in the workplace. Look at the statistics on workplace ill health and the impact that that's having on the economy, on quality of life, on doctors, the burden that's being presented on GPs with people not being able to work or struggling to stay in work with long-term health conditions. We've 1 in 2 of us are looking forward to, fortunately, a cancer diagnosis. The other 50% will be their carers. How can those people be effective, productive, and have any kind of quality of life at work when they're struggling with these huge conditions? Health coaching can make a difference. There's where the transformation is, in the integration of health coaching, not as a separate thing over there, but within the systems themselves.
And there are lots of people training to be health coaches. How do you maintain quality? Because there's a lot of wisdom involved in being a health coach, holding back and enabling.
Mhm.
How do you make sure within the network you've created that everyone is qualifying in a way that creates kind of a good workforce?
We have obviously, we have the standards for education and training for health coaching. They are the highest in the world. They really are the highest in the world. We've worked very hard to create standards that are internationally respected, that align with every organisation of relevance, the ICF and internationally, the Personalised Care Institute and the NHS standards in the Workforce Development Framework, EMCC in Europe. Our standards align with all of those international bodies and national bodies, and their whole health. So they integrate whole person well-being. So it's not just about the health pillar or the mental health pillar or the lifestyle pillar. We integrate um, coaching competencies within a person's whole life. So the model that underpins it is that biopsychosocial, emotional, environmental, even context within which people live. It's the whole person in their context. And increasingly looking at cultural sensitivity for people of different cultures, what is important to them, how do we look after people that are in underserved communities where we know health inequalities are greatest, where we know that need is greatest. So we've tried very hard to create education and training standards which set the curricula for our approved training programs. Those approved training programs, some of them come from the UK, some of them are international. All of them have to meet those robust standards. So there's a pillar for education and training the faculty. So then they need to be able to demonstrate that they meet certain criteria in order to even deliver the course. That there's this number of hours that need to be put into a course. Our approved full programs are minimum of 600 hours education and training. There are the assessment criteria, the assessments that they go through, the quality assurance processes that we put in place for the faculty itself. Then there are the coaching standards, for what are the coaching skills and competencies a health coach needs. And then there's the health and wellness pillar. That's not about being a quasi anything, not a quasi doctor or nurse or health practitioner. It's about having a really solid foundational underpinning of health literacy yourself. Um, then there is the professional practice about ethics, about how you are, about CPD, about supervision, about career progression. And now we are introducing this year advanced practice standards in cancer and oncology care, health coaching for cancer and oncology care, chronic pain management, and increasingly people are saying, but we need more. We know that coaches want to specialize in particular areas. Metabolic health is another huge area,
Mm,
but we want to do it properly and we want to do it well. So this year
mm.
we've determined to commence work on pain management and cancer.
Yes, and I have a big interest in metabolic health and how, with the right kind of knowledge, we can make changes, but we still need a lot of help to make those changes. And I've been intermittent fasting, long fasting with the medical students at the moment. We're doing something called Let's Go Keto. Um, so that we can really understand low carbohydrate cooking and eating. And it's been great fun. We're not recommending a ketogenic diet all the time, but what I'm aware of is that I've been my own coach, but I can imagine that would be really important. So in a way, what you're saying is that there might be some health coaches who then do get specialist knowledge in an area.
Yeah.
How are they going to manage those two spaces?
They will have specialist knowledge of the situation of the client. So it m- may not be, unless they want to, get an additional scope of practice. So the scope of practice for a singly scoped, I can't say that, a singly scoped health coach is quite clear. And we've written a discussion paper actually available on the website to help people understand what health coaching is and what it's not. And that doesn't mean that you, as a single scoped health coach, cannot decide to attain an additional scope of practice. So you may want to train as a nutritionist, nutritional therapist, or a nutritional advisor. Now, those three things just within or a dietitian even. So they're all about food and nutrition, but their scopes of practice are very different. So the
Mm,
things that a dietitian can do and a qualified nutritional therapist can do are very different from a nutritional advisor and a nutritionist. And understanding the differences in the boundaries is tremendously important. Now, with health coaching, if you want to go down that road, now I'm trained as a nutrition and lifestyle medicine health coach. So my training encompassed all of that. I'm not a nutritional therapist.
mm,
Is a huge difference. I am not trained or insured or scoped as a nutritional therapist. But what I can do is support clients with their understanding of what food based support, what kinds of foods support body systems. So, what kind of nutrients support a cardiovascular system or the digestive health? Or the nervous system, or the respiratory system, or the musculoskeletal system. And as you know, if you've delved into nutrition, in that kind of at that level, you know that different foods, different food groups are important for different kinds of physiological results. So I can do that at the systems level. But when a client comes needs treatment for a specific condition with nutrition, that's not within my scope.
mm.
Then refer to a nutritional therapist or a dietitian.
You seem really clear in a great way. Not sure everyone is in the bigger kind of integrative medicine field. There is sometimes a lack of clarity, but it's great that you're so clear.
We spend a lot of time and effort with our members clarifying scope of practice, making sure they understand what's within and without, making sure that they understand that they are whether they're doing CPD for an addition to add to their knowledge base to inform their coaching practice, or whether they're wanting to attain an additional scope of practice. We spend a lot of time teaching them how to take the expert hat off and put the coaching approach hat on, because the expert hat will say, I recommend this, this, and this, and this course of action. a coaching hat will say, "That's interesting, Elizabeth. We've shared about whatever it is. You've told me about this issue for you. Can you think of anything that you've done before when you've had this kind of challenge that's worked for you?"
Mm.
And that introduces that self-efficacy, that agency. With my knowledge base, I can support a client or a patient to access trusted resources of information, but that's not the same as giving direction or giving instructions or making recommendations. So
Mm.
spend a lot of time. The schools do a reasonably good job. They're doing a better job year after year. When I first came into this post, none of our schools, apart from two, taught scope of practice. And there was a bit of a revolution when we said, right, we have to get our heads around this. Because if you don't stay within your tram lines, you risk patient safety,
Mm.
reputation, litigation, and undermining the very profession that could be the beating heart of the future of healthcare. So it's terribly important. It's terribly important that clinicians understand the coach's scope of practice, because very often they don't. And in some contexts, patients are referred to them which are not within their scope of practice. And that's really hard, for the coach then to be able to say, I can't work with this patient. They need to be referred to X, Y, and Z specialist.
Interesting. I think that's a very important discussion, and
Mhm.
I'm wanting you to teach on our master's program. Um, I see you with enormous energy, Isabella. And so we're coming up to the end of our conversation, but I want you to talk about what the future looks like. You've been driving this vision. What does the future look like to you, say in the next 3 to 5 years, if health coaching kind of flourishes as you hope?
Oh my goodness. Well, we've always said that our mission, um, and our purpose really, is to see a self-empowered population thrive, enjoying a quality of
Yes.
life and being agents in their own creation.
Mm.
We believe and we know that it does not matter where you are on that journey, on that continuum from ill health to, well, if there's any such thing as perfect health, it's a journey. Wherever you are, you can create better wherever you are. So the first thing I'd like to see is more and more of us. I'd like to see health coaching in population health, in
Mm.
in every aspect of any industry, any sector in our society, with a vested interest in improving our population's health, needs to integrate health coaching and skilled health coaches within it. Um,
Mm.
we need to lead for well-being within healthcare. We need to lead for well-being in organizations, in education. We need to lead with the idea that everybody's um, human right is to be able to create better health for themselves. So we want to see a health coach and a health coaching approach integrated into every aspect of health care, into primary, neighbourhood, community, secondary care, collaborative teams, integrative medicine, especially. And as you know, I've recently joined the council for the BSIO Council for Integrative Oncology, and I'm so committed to making sure that we get health coaching into integrative oncology as a core pathway to support people right from the point and before diagnosis, waiting for that diagnosis, right through to the other end when they're attempting to pull their lives together after,
Yes.
a
I-
journey. So all
Is
basically, it needs to be everywhere. That's what I'd like to see. In 5 years, I would like us to all re-educate ourselves as professionals and as caring citizens, that we want to see our communities and our society live better, live well, and that we put resources into that as well as treatments. And it's that prevention agenda.
We're so well aligned, the National Centre for Integrative Medicine's tagline is inspiring health and well-being because we need healthier nations. We want to be healthier. We need healthier nation, but it's like, what's the journey to that? And I
Yeah.
do so agree with you that health coaching is a big part of that journey. It's very interesting to me. A friend who's been a GP for over 30 years has just trained in health coaching, given up her license, trained in health coaching, because actually health and well-being is always what she's been interested in, and she's become a very enthusiastic health coach. Isn't that interesting, that transition, from kind of a system that's quite burdensome that people get stuck in, but their underlying values are, I want to see people get healthier. But actually, over the course of the last 15 years, people have got sicker. So we kind of sound a bit naive. I don't think we are, Izabella, but we sound a bit naive that in the face of increasing illness, we're saying we believe that nations can get healthier.
Yeah. Well, but we have to start. We have to do it. We have to put the resources and the political will. I mean, that's actually that's where that's the bottom line. There must be more than rhetoric. There must be more than plans. There need to be investment in human health, investment in health creation, investment in a future that says to our children, we are going to do better for your generation than we have for our own. And for me, this integration is really it's multi dimensional. Integration for me within an individual, the integration of mind, body, spirit, environment, all of those things that make up the human in the lived experience. There's the integration of modalities of within all of the different treatments and the complementary and supportive treatments, integrating them in a meaningful way, not in silo. Oh, you go here for that and here for that,
Yeah.
and where else for that, but places of healing and healthcare where an individual can identify what is important to them, what will support them in an integrative approach, and that they don't have to race around the country or the district to get all these different things. And then integration at a systems level so that this becomes an accepted way of
Yes.
doing health, not a complementary or an alternative way of doing
It's not a luxury add-on. This is
this.
vital.
Yeah, yeah.
Yeah.
So
Yeah.
I just think it's like the Matrix, really. And at
Yeah.
every point, and but the point is, at every point, who wins? The patient wins, people win, human
Mm.
health wins, because we're not here, I don't think, to be smart health coaches or doctors or whatever. We are here because people matter, and we are here to make sure that we have a healthy, thriving society where everybody gets the best chance that they can.
Right. Well, I think it's a wonderful moment to finish. Isabella, I can imagine you lobbying at the highest level. We have to shift the balance, don't we, away from vested interests that are powerful in that field at the moment, that don't always have human health and thriving,
Mhm.
at the core of what they do. So it feels like there are so many of us now. We're coming together in this transformation, and meeting you's been a deep inspiration to me. So thank you, Isabella, for coming on this podcast.
Thank you.
And we'll put lots of links in the show notes so that you know what Isabella's been discussing with some of the networks and initiatives. But thank you, Isabella, so much.
Thank you very much.